that I put up is for both fluid and acid base. So if you've already printed them off, there comes a stopping point. Okay, and you'll notice it because it'll start saying, there'll be a page that says acid-base imbalance, and it's a picture. Okay, so that's where you're going to stop for this first test. This first test is only on fluid volume deficit, excess, the potassium imbalances, calcium and sodium imbalances. And then the acid-base imbalances are for your second test. Okay, but the PowerPoint's just combined. All right, so pay attention to that. Okay. Now, there are a couple of things that I want you to do for me. The first one is, and if you look at the class schedule, and those people who don't have it, if y'all would just kind of share. You do have on Blackboard, I've divided it up into two sections, Unit 1A and Unit 1B. Unit 1A is the fluid and the electrolyte imbalances. You have 2 web-enhanced activities, and you have to mark review. Have you ever done that before? Have you ever had anything we had to mark the review button? It's just on there after you look through it. One of them is just a PowerPoint presentation on the balances, because this unit, what we're talking about is imbalances. You should have learned normals and balances in anatomy and physiology. But that's where a little bit of your homework over Christmas break should have refreshed your memory too. If you don't mark reviewed, it will be unsat because I will assume that you have not done it. So make sure that you mark reviewed, okay? And there's also a IV article. We're going to talk about IV fluids and the types of IV fluids and why they're hanging and what we're going to do with it. There's an IV fluid article and an article on childhood fluid balance. So those two you should see. And then under Unit 2, there's an acid-base review where you have to mark review. Okay? It's a lot of information right here at the very beginning. And again, this is a hard unit, so you just have to bear with me, okay? Everybody with me so far? All right. And I've got on here this semester is going to go very quickly. Do not let yourself sink before you ask for a life preserver. That's why we're here, okay? If you have your deer or your deer in headlights, this might be a good time to use them. All right, so you can dig out your deer and use those. All right, any questions before we get started? Any housekeeping? No, pretty good. Okay. All right, so the first thing we're going to talk about is fluid volume deficit, or what you would commonly know as dehydration. Okay, fluid volume deficit, which is the fancy word for dehydration. Now we're going to talk about 3 different terms when we talk about fluid. I should have checked to make sure I have good markers. Okay, isotonic. Isotonic, hypotonic, okay, and hypertonic. What does the word tonic mean? Well, it doesn't really mean solution. What is tonicity? Fancy word, tonicity. Concentrate, the amount of concentrate or solute that's in a fluid. Okay, so when you're talking about the tonicity of a fluid, okay, where that tonic is right there, you're talking about the amount of solute that's in that fluid. Now, when we use the word solute, we are really talking mostly about sodium. We will talk about other things as well, but sodium in dehydration is what we're really focusing on, because what is the relationship between salt and water, or sodium and water? It follows it, doesn't it? Water follows sodium, right? Okay, so that's going to let us know if they're dehydrated or if they have fluid volume excess. So when we're talking in this case about solute, we're really talking in this instance about sodium. All right, isotonic dehydration or isotonic fluid volume deficit means equal. Isotonic means equal, okay? Fluid, the body loses water or fluid and solute in equal proportions. Okay, so the body loses water and solute in equal proportions. Okay, so isotonic means equal. This is the most common type of fluid volume deficit. Isotonic fluid volume deficit is the most common type of fluid volume deficit. Okay. This type of dehydration decreases circulating blood volume. Okay? So again, if there's not enough blood circulating, what is that telling me about perfusion? We're not getting any, are we? Okay? We're not getting any. So this type of dehydration decreases circulating blood volume. Okay? So that tells me that we're not getting any perfusion to the tissues. And that's the serious side effect, isn't it? If we're not getting perfusion to the tissues, what's going to start happening to those tissues? They're going to die off, aren't they? They're going to die off. Okay? Now, what causes isotonic fluid volume deficit? Hemorrhage is one example. Hemorrhage. Okay. Another example is GI losses, such as vomiting and diarrhea, and that's the most common cause of isotonic fluid volume deficit. GI losses, vomiting and diarrhea. This norovirus that's going around right now. Anybody have the stomach bug over the Christmas break? I believe it wears you totally out. That wipes you clean out. And if you're not careful, especially in what age groups would it really affect? Children and the elderly. So both ends of the spectrum. They really have a difficult time handling that. Okay, so GI loss is most common. Fever is another example. Because fever causes what? What does it produce? Sweating. When it breaks, sweating. And you know that sweat tastes very salty, right? Makes sense? Okay. Burns. NG tube suction. NG tube suction. Carbon monoxide poisoning, CO poisoning. When do we see that a lot? What time of year? Winter. You know, several years ago, I don't know if y'all were probably like 2, but there was a huge ice storm and we lost power for like a week. And we had tons of people being admitted to the hospital with carbon monoxide poisoning. Because what they were doing is they were turning on their gas logs, but they didn't have power to run the fan. And so the carbon monoxide was building up. And they were getting carbon monoxide poisoning. Okay, this is an interesting thing. According to the World Health Organization, dehydration secondary to diarrhea is the second leading cause of death in children less than 5. That's significant. The second leading cause of death in children less than 5. Dehydration secondary to diarrhea. So what does that tell us about this type of dehydration? We need to act on it very fast, very quickly when it occurs. Okay.
Second leading cause of death in children.
Less than 5. All right, now I want to talk about something. I want to refresh your memory too about something else. When you were talking in anatomy about cells, do you remember talking about intracellular and extracellular? You remember that? Okay, so here's our cell. Intracellular fluid is ICF. Extracellular fluid is ECF. And this is going to really come into play too when we're talking about electrolyte imbalance. For example, when you draw a lab, say I want to draw a lab for potassium value for a patient. I want to see what their potassium is. They are drawing the amount of, they're drawing the serum and looking at the amount in the ECF, in the extracellular fluid. They're not breaking down and doing cell lysis and looking to see what the potassium is inside the cell. So that's going to become really important when we talk about electrolyte levels. But for this purpose, I just want you to know that fluid, specifically isotonic fluid volume deficit, when we're talking about intracellular and extracellular, fluid is basically only lost in the extracellular space, fluid and sodium, for fluid solute. This is where it's lost from. So the intracellular, the cells are going to look the same. The cells remain the same shape, the same size. That's going to change in just a second. Okay? So for an isotonic fluid volume deficit, the cell remains the same. Fluid and solute is only lost outside the cell. All right? Everybody with me? The shape of the cell remains the same with isotonic fluid volume deficit. Okay? Fluid and solute, in this case sodium is what we're talking about, is only lost from the extracellular fluid, the ECF. Okay? So isotonic, equal, let's just review real quick. It means it's equal. It's the most common type of fluid volume deficit. The most common cause is GI losses, vomiting, and diarrhea, amongst other things, but that's the most common one. All right, hypertonic. Let's talk about hypertonic next. Hypertonic means that more water is lost than solute. More water or fluid than solute. Okay? It pulls water. There's more sodium out here. Okay? There's a lot of sodium out here. So water is pulled out of the cell into the extracellular fluid, because remember, water follows sodium, right? Pulls it out of the cell. So what is this cell going to look like? It's going to shrink. It's going to shrivel up. So instead of it remaining the same, like with our isotonic dehydration, with this type of dehydration, this cell is going to be all shrunken and shriveled up. See? Like this. Okay? Because the water that's inside the cell is going to follow all this sodium outside the cell. And so these cells are going to be shriveled up and shrunken. Okay? So it causes the cells to shrink. Okay? Now, why does this occur? One of the most common causes is inadequate fluid intake. You just don't drink enough. Okay? Infants, because they can't tell you they're thirsty, are at risk. The elderly, specifically those with altered mental status, because they don't remember that they're thirsty. Okay? What about patients that are NPO? Would they have this, be at risk for this? Mm-hmm. Okay. That's one of the causes. Another cause is severe and prolonged fluid loss. Excessive vomiting and diarrhea. Now, this is not isotonic. when we talked about vomiting and diarrhea with isotonic, that's your 2 to 3 day GI bug. This is extreme long periods of time with vomiting and diarrhea. Hyperemesis gravidarum, people who are pregnant, have pregnancy hyperemesis. It goes for weeks, that they throw up every day, all the time. Shigella, we had a Shigella outbreak last fall, remember that? We had children admitted dehydrated because of that Shigella, because they had gone a week or more with diarrhea, watery diarrhea. Crohn's disease. Okay. What else can you think of? Severe, excessive vomiting and diarrhea. Chemo. Okay. What about bulimics? Would you think that would cause some issues? Yep. Okay. Another cause of this is diabetes insipidus. What is diabetes insipidus? It has to do with, it's not the mellitus, it's not what we're used to. They urinate too much. They have inadequate ADH production. Y'all remember that from anatomy, ADH? They have inadequate ADH production. And they have massive, massive, uncontrolled diuresis. They may urinate up to 30 liters a day. That's how much. That's a lot of pee. 30 liters a day. Okay, so massive, uncontrolled urination. So that's diabetes insipidus. Okay. Increased solute intake. What happens when we go eat Mexican? And I love Mexican food. I could eat it every day, all the time. Have you ever noticed, though, afterwards, how thirsty you are? Because of the salt, because of the sodium. So eating that much sodium is doing what? It's pulling the water out of the cells. Have you ever noticed that? Have you ever eaten something really salty, or you just have a potato chip binge or something and you're just really, 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 really thirsty? How about sweet stuff? Because glucose works the same way. Have you ever noticed if you eat too much sweet, you're really thirsty still too? Or drank too many soft drinks, you really drink a lot. Okay, so increased solute intake without water. One example too of that is improperly prepared formula. People trying to save money or on water, or they're just not educated enough on how to mix formula. And improperly prepared formula. They have too much formula as opposed to the water. Now we're going to see the opposite in just a minute. But improperly prepared formula. That is something I don't think we teach really well in OB before the patient goes home. We do a lot of other things. We teach all the risk factors and what you're seeing and all that. But we don't know if, first off, you have to know if they can read. And you would, I don't know, you may not be surprised. There's a ton of people out there that cannot read. They cannot read. And they have to be able to read the back of a formula can. Okay, and they may not understand how to do that. So that's something we really need to educate on. Okay? All right. So fluid volume deficit, hypertonic. All right. Hypotonic. Hypotonic. Fluid volume deficit means that more solute is lost than water. Okay? So what happens to our little cell now is that water is pulled where? Inside. Water is pulled from outside in the ECF to inside the cell. Instead of it shrinking, what's it going to do? It's going to swell. It's going to swell. So hypotonic means that more solutes than water are lost. water is pulled from outside into the cell, and it causes the cell to swell. It's doing that in an attempt to prevent cellular dehydration. The body is trying to fix itself. But the problem is that sometimes it can overcorrect. Okay? There's nothing to absorb it. Okay? There's nothing to absorb it. Okay? So it causes hypotonic fluid volume deficit. This is the least common type. You might hear this referred to in the medical field as third spacing. If you've ever heard that term, especially on cardiac units, they'll say they're third spacing. What that means is that all that water has been pulled into the cell, and you see edema, pulmonary edema, edema around the heart, in the periphery. So you see a lot of edema. What causes it? Your chronic illnesses like cirrhosis of the liver, cancer, any of the failures, heart failure, renal failure, liver failure, all the failures. And that makes sense, doesn't it? Because if you've got too much fluid, it's going to overwhelm those systems. They can't excrete it. They can't get it out. So heart, renal, liver. Okay.
Does that increase your, does it make your red blood cells swell as well?
It can. It's more common in just the regular, normal tissue cells.
If it does make your red blood cells swell, does
They
that
can
mean
burst.
it can carry more oxygen?
No,
Okay.
it dilutes it. And they can burst.
Okay.
So, okay, in the tissues, edema is a problem. We just talked about that. Edema all over. You're going to see swelling in not only in the periphery, but anywhere that there's dependent edema. So if you've got patients who are bedridden, where would you see edema most?
Legs.
If they're bedridden, on their back and their sacrum, because they're in the bed. They're lying flat. So fluid's going to pull along what's dependent. Does that make sense? So we really have to be careful. We really have to watch out for tissue breakdown in those areas. So it's not just, everybody thinks about edema in the feet and the hands and all that, but if you've got a bedridden patient who can't get up, it's going to settle in a different spot. Chronic alcoholism is another cause of this. So you'll see alcoholics that are swollen. They may be very thin, but their tissues are swollen. The brain cells, the cells of the brain, are the most sensitive cells to swelling, to fluid change. The cells of the brain are the most sensitive to fluid changes. So you're going to see a lot of neurological problems with this. A lot of confusion, agitation. What else do you see with alcoholics or liver, people who have cirrhosis of the liver? What about their belly? It's big, and it's called a ascites, A-S-C-I-T-E-S, A-S-C-I-T-E-S, ascites, where fluid settles in the abdominal wall. We've already talked about fluid around the heart and the lungs. So if you're listening to these patients, what are they going to sound like? They're very congested, crackles, bronchi, wheezy. They're going to have, what about their pulse ox levels? Probably going to be low, right? Because they're not getting enough oxygen. All right, let's talk about risk factors for fluid volume deficit. And we're talking about all of them in general. And what I did on your PowerPoint slides, when you get to them, is there's pictures. Instead of putting words on the slide, I just put pictures. So we're going to talk about each of those different pictures. The first one is a picture of a baby So age, there's also a picture of an elderly person on there. So both ends of the spectrum, infants and elderly. For infants, the reason that they are more at risk for fluid volume deficit is that the kidneys are not mature until the age of 2. The kidneys are not mature until the age of 2. So they cannot conserve or excrete fluid like we can. They can't conserve it in cases of hypertonic dehydration, and they can't excrete it if they need to get rid of it, like with hypotonic dehydration. So they can't conserve or excrete. They also have a higher metabolic rate than us, so they lose more fluid through fever and sweating. Fever in children tends to run higher. Very rarely do you as an adult have a temperature of 105, right? That's more common in little ones. So they do tend to run higher fevers. They have a higher metabolic rate. Okay, so those are just some things about infants. The elderly, after the age of 60, only 45 to 50%, only 45 to 50% of their body weight is water. After the age of 60, only 45 to 50% of their body weight is water. So what that's saying is that small water losses can affect them dramatically. We go back to a similar situation as when we are an infant. When we are elderly, our kidneys, again, cannot dilute or concentrate our urine. So our kidney function has changed. And we also talked about the thirst mechanism. As we age, we have a diminished thirst mechanism. And I mentioned people who are confused, but it can be on anybody. As we age, we tend not to act as thirsty or be as thirsty as when we are younger. I read an article one time, and it was a good article, and I used to use it in this unit several years ago until it aged out. But it was an article about, they did a study hiring someone that their chief duty in a nursing home was as the refreshment person. And they went from room to room constantly, offering them something to drink, staying with them while they take a sip. Because you can set it on the bedside table of a patient with Alzheimer's and they won't remember it's there. They won't know it's there. So you actually have to stay there with them to get them to drink it. And it was an interesting study, and it showed that the patients, the residents of that nursing home, fared better and had fewer instances of urinary tract infections and confusion episodes because they kept them hydrated. So I thought that was an interesting article. So that's just something to remember when you've got your patients in the hospital. If you've got your elderly patients, please make sure that they're drinking like they should, because they won't remember to. Okay. I took a picture of a guy who is exercising. Women and obese individuals have a higher percentage of body fat, and body fat holds more water than muscle does. So women and obese individuals have a higher incidence of holding our water and not getting rid of it. What time of the month is also affected by water weight? Yeah. So hormonal changes can affect holding water weight. All right, we're still talking about loss, acute illness. And when I talk about acute, I mean things that are going to come and go quickly. We mentioned the GI bug. Surgery. We haven't mentioned surgery yet, but could surgery cause a deficit? Okay, because of the blood loss or the fluid loss during surgery. Chronic illness, we mentioned cancer, diabetes insipidus. All those problems can cause it. Environmental factors, vigorous exercise is a risk. You know, of course, because you're sweating. Overheating. I went to Italy several years ago. I think we talked about this when we did physical assessment. The air conditioning was out. People were dying left and right because they didn't have air conditioning. And, so we have to really, when it gets hot outside, we have to really make sure we can have the opportunity to cool off. Diet and lifestyle can cause fluid volume losses. Excess alcohol consumption is one example. I'm sure none of you in here has done that. I, however, have, and you are very thirsty afterwards. The next morning, you're very cotton-mouthed after you've had a lot of alcohol. Because it does what? It dehydrates you, doesn't it? It does dehydrate you. And then there are certain medications, too, that will cause risk factors, fluid volume deficit, like diuretics. Okay. All right. So let's talk about assessment. Let's talk about what do these people with fluid volume deficit look like. Okay. The biggest, most accurate indicator of a fluid loss or gain, the best indicator of a fluid loss or gain is weight. Okay? So acute weight loss in this example, the best indicator of a fluid change is weight. You might think it would be thirst, but thirst is unreliable. It is a sign and symptom. You can put it under your sign and symptoms, but it is an early sign and symptom, and it's unreliable. It's unreliable because the elderly don't express thirst like we do. We just talked about that. And infants can't tell you they're thirsty. Right? So you can't just wait for someone to tell you they're thirsty before you start to assess that. Concentrated urine is a sign and symptom or an assessment. And low volume, not just concentrated, but low volume. So the urine is going to be very dark, very thick, and low. What is the minimum urine output in adults? You remember? 30 milliliters an hour. Anything less than 30 milliliters an hour is a concern. In children, it's 1 to 2 milliliters per kilogram per hour, because everything with children is based on weight. So minimum urine output for a child is 1 to 2 milliliters per kilogram per hour. Okay. What would this? Yes, babe.
Does that go to a certain age?
We usually what we say is 12, 13 years old when they get to be at the size of an adult. Some 12 and 13-year-olds are very small though, very tiny, so you might with weight, so it depends on their size. All right, what does the skin look like? What would your skin in a fluid volume deficit? Very dry, flaky, tinting, skin tinting. Where do we check tinting on an elderly patient? Sternum. Where do we check it on a child, an infant? On their abdomen. On their abdomen. Abdomen on an infant. sternum on a elderly person. And again, don't just look at their lips and say, oh, their lips are dry, so they must be dehydrated. It just be they have dry lips. You know, this time of year with the dry heat, everybody's lips get chapped. Mine are chapped right now. Everybody's lips are chapped. That doesn't mean I mean, this is my second bottle of water today, so I'm not dehydrated, but okay. Something we look for in babies when they come in, one of the things I always ask is, when they cry, do they tear? That's something you always want to ask a parent to assess their hydration status. If they are crying, uncontrolled, but they just don't feel good, are they still producing tears? If they're still producing tears, then we're still okay. If they're crying and they're not producing tears, then we're already dehydrated. We need to fix that. So tearing, and they need to know the difference too between just a mad child, because there's children out there that can act like they're crying and they're screaming their heads off. Those of you who are parents, haven't you ever looked at your child and say, you are not producing any tears? Well, I know you're faking it. You know, I've done that with Ben before, but this is a little different. Okay. Flat neck veins. Flat neck veins. Your jugular veins will be sunken and flat. Eyeballs may be sunken in. A fontanelle on an infant, on a newborn, the fontanelle will be sunken in. It'll be a little dip or a little gap on top of the head. What about their blood pressure? What do you think? Blood volume deficit. Low, and you may see some orthostatics. You know, when they get up and down, it may drop. What else might they complain of when they stand up? Dizziness, weakness, lightheaded. And then we talked about, remember I said that with hypotonic dehydration, about how cerebral cells absorb more water, they're more sensitive to more water, and so it would cause what kind of neurological change? Confusion. That is one of the biggest signs in an elderly patient of a urinary tract infection, is confusion. All of a sudden, they go to see Grandpa and he has no idea who they are, he's combative, and it could very well be something as easily fixed as a urinary tract infection or dehydration. So, got to be very careful about that. Mental status changes. These are some interesting numbers. I'm not going to test you on these numbers, but it might be something you want to write down just as a guide. Remember I said that changes in daily weights is the best indicator, right? A fluid volume deficit or a fluid volume excess. A weight change of 1 pound equals 500 milliliters of fluid. One pound equals 500 milliliters of fluid. So if you've lost 2 pounds, how much fluid have you lost? 1,000, or a liter of fluid. Okay. So that's just kind of an interesting factoid just to know. Okay. All right, now let's talk about some labs. Y'all started doing labs in 111, right? Mm-hmm. Okay. One of the most important labs for this unit is hemoglobin and hematocrit, specifically hematocrit. They order those. They'll order it like this a lot, HGB, and then they'll do a slash. Hematocrit. Hematocrit is what we really are looking at this unit, because hematocrit is letting me know how concentrated the urine is. Okay? Not the urine, the blood. How concentrated the blood is. So hematocrit is telling me concentration. What is hemoglobin telling me? The oxygen level, or the amount of oxygenated blood that the body has. And hematocrit is telling me how concentrated it is. So in a fluid volume deficit situation, what would you expect it to be? High. High. Because it would be very concentrated. Okay. So a fluid volume deficit, the hematocrit would be high due to fluid volume deficit, due to concentration. BUN is a kidney test, blood urea nitrogen, BUN. It would be normal to high. Specific gravity of the urine would be high, greater than 1.030. Did y'all talk about specific gravity and anatomy? Yeah. So yes, something. Again, that's how concentrated the urine is, how much solute's present. High. Okay. And then, of course, they're looking at those solute levels that we're talking about. The sodium, they may be looking at glucose. You know, we mentioned sodium throughout this whole thing, but what would, if you've got a diabetic whose blood sugar is really, really high, so they're spilling a lot of glucose, that could cause a fluid volume deficit as well. They can be just as dry, just as dehydrated from a glucose imbalance as we can with a sodium imbalance. So it's just something to keep in mind. Okay, nursing diagnoses. And I threw some of these in here just so that you guys would remember or know some of these. Nursing diagnoses, the first one is fluid volume deficit, which is one that you will use quite a bit. Fluid volume deficit. Could they be at risk for fluid volume deficit? Yeah, it could be. And so that's one that you can use a lot. Okay. Risk for injury because of the mental status change. Altered comfort. Impaired skin integrity. Those are just a few. Okay, so let's talk about now, what are we going to do about it? Oral replacement therapies. All right. An adult weighing 40 kilograms or more, an adult that weighs 40 kilograms or more needs at least 30 milliliters per kilogram per day of free liquid intake. Do you think you do that? Calculate that up. Kind of guess. You don't have to tell what your weight is and anything, but try to calculate it up. See how much you think you need a day. How much you think? Just out of curiosity, just kind of see if you think you do it. What do y'all think? You know you don't do it. You probably do what?
3,000 ml per day. What was that? How many gallons would that be?
A
A lot.
3-liter Coke bottle
What was that for?
of water.
I think 100 gallons.
That's good. I know I don't. I can already tell you, I know I don't. I do not drink what I should, but that's what they say to prevent a fluid volume deficit. You should have that. Okay, Fluids can only be replaced orally. Fluids can only be replaced orally if the deficit is mild, thirst is intact, and they can drink. Well, that makes sense, right? If the deficit is mild, thirst is intact, and the client can drink.
Now, is that include thickened
Yeah, it would include thickened liquids, but you really have to be careful with thickened liquids because they have a lot of solute. So, all right, so examples of oral replacement. That's your Gatorades, your Pedialyte, Infolite is another one that's out there now. But have you ever tasted Pedialyte? If you've never tasted it, you need to taste it. It's very salty.
I got a whole bottle of it.
Very salty. You can bring it, everybody can have a sip.
My girl won't drink.
Yeah, it's very disgusting. You can get a baby to drink it pretty easy because they don't know any different. But then you get older, it's a little harder. I don't like Gatorade.
I don't either.
I know a lot of people do, but I don't like Gatorade. I think I can really taste the salt in it. But those are some types. They do make Pedialyte freezer pops now, which are a little bit easier, especially if you've got a child that had a tonsillectomy and they won't drink, or steroids. It's a little bit better. Okay, freezer pops. If you've got a child who has a fluid volume deficit and it's due to a stomach virus, they're losing it through vomiting and diarrhea, they don't need to go straight to formula. Formula is milk-based. Milk is the worst thing that they can drink on an upset stomach. You all should know that. It kills me how many parents bring their kids in and they've got these babies who've been throwing up for 3 or 4 days and they want to give them a bottle, give them a bottle. Well, they're going to throw it right back up because the worst thing, think about it. Think about the last time you had a stomach virus. Was milk the one thing you wanted? No. Milk's just curdles on your stomach. So, replacing it by other means like Pedialyte and stuff like that is the best way to do it. When you have, though, someone who has a fluid volume deficit and it's due to a GI bug or diarrhea or whatever, you want to avoid fruit juices specifically because they're high in what? Sugar. They're high in glucose, so the solute level is very high. You want to avoid fruit juice. You want to avoid sodas. Okay. Because their sugar content's high, they can promote fluid loss through diarrhea. Salt and caffeine. You want to avoid salt and caffeine.
Why does everybody want to drink ginger ale?
Because ginger is a antiemetic. Ginger is one of the best things for a stomach virus. Ginger ale is okay, but you want to limit the amount that you drink. Anything with ginger in it, ginger tea, ginger snaps, ginger ale. Ginger is a wonderful, wonderful thing for a stomach virus. But a lot of people don't want to do ginger ale, they want to do Sprite. Well, that's not going to get it. Okay? So if you don't like ginger ale, then you might as well go to something else. But you really want to avoid that. Have you ever heard of the brat diet?
Yes. Right.
Bananas, rice, applesauce, toast. There's also a bratty diet. B-R-A-T-T-Y, 2 T's, and the other T is tea, and yogurt. Those are good foods to start back on your oral replacement after you've started the liquids back, when you start on foods back, even for adults. The brat diet is a great thing, or bratty diet is a great thing. You can even do it with babies. They have baby food bananas. You can add rice or make rice cereal for them. Baby food applesauce, they make baby yogurt. Okay, so bratty, bananas, rice, applesauce, toast, tea, and yogurt. Okay. Now, there's some physicians out there I know now that are not, pushing brat diets as much. They just say, well, whatever they can tolerate. But you really want to stick with the bland stuff, and that's the good thing about the brat diet is it's bland. Those things are bland foods, and that's what you want to start back with. Okay? So the brat diet. So that's oral. Remember, we can only replace or fix the fluid volume deficit with oral fluids if the thirst is intact, they can drink, and the deficit is mild. Otherwise, we have to go the IV route. Okay? The IV route. Now, I'm actually going to stop there because I want you to read the article, the